Have you ever taken a selfie and when you look at it, you notice that something does not feel right? You see an eye looking more sleepy than the other one, or one smaller and one bigger, or their tilt does not match up. The reason you see it in the pictures and not in the mirror is because a picture is a frozen frame, allowing you to see the true asymmetry in your eyes. But in the mirror, you are constantly moving and adjusting. You won't be able to notice the asymmetry unless if it is very severe. Anyways, that went on a tangent. In today's video, we'll be discussing asymmetrical eyes. This video, like many others, will be split into multiple parts. Part 1 about what causes the asymmetry in the eyes, and Part 2 will be about non-surgical fixes for asymmetrical eyes for both men and women. If you want to support the channel and get a detailed facial analysis with personalized Looksmaxxing advice, link will be down in the description. If you want to read more about topics like these, you can find them in my personal blog at nerofacerating.com. Without further ado, let's get this video started. It is extremely rare to be perfect or nearly perfectly symmetrical. Some people may have asymmetrical eyes naturally. It may be more obvious in some people than others. However, certain lifestyle factors can cause asymmetrical eyes, such as smoking. The et al. In 2014 found that environmental factors affected identical twins' facial symmetry. The researchers stated that smoking could cause upper eyelid ptosis or droopy eyelids. Sun damage can also make your eyes asymmetrical because the UV rays can damage the skin around the eyes. If there is more sun exposure on one side of your face, you may notice gradual asymmetry. Aging is another common cause of asymmetrical eyes. The skin loses elasticity and collagen as we age. Our skin are very susceptible to becoming droopier and sag above our eyes with age, potentially making the eyes look uneven. However, asymmetrical eyes can be a symptom of an underlying condition, like Bell's palsy or Graves' disease. If you have asymmetrical eyes because of an underlying condition, you may need to opt for another procedure like blepharoplasty. For instance, let's say that you have ptosis. If this ptosis progresses further and make it difficult to open your eyes, then you would likely need to get surgery. So how to fix asymmetrical eyes without deep and intrusive surgery? Botox is a neurotoxin that can help correct asymmetrical eyes. Botox injection work by blocking signals from the nerves that makes your muscles contract. Strategic Botox injection can relax and open up the eyes. For instance, let's say that you have narrow, tired-looking eyes. A surgeon may inject 1 to 2 units of Botox directly under the eyes to relax the muscles surrounding the eyes. The Botox should make the lower eyelid open up to make the eyes look more awake. Another example would be if one eyelid looks smaller than the other. A doctor can inject a small amount of Botox into one eye, letting it relax and open up to be the same size as the other eye. However, a doctor may perform a snap test to see if the Botox is suitable for you. The snap test will check if your skin is loose or tight in the targeted area. A doctor will pull the skin away from the face, then release it, letting it retract. Retraction will be easy to see if the skin is tight. However, it will retract to the face slowly if the skin is loose. A doctor may suggest an alternative option if you have loose skin. People with loose eyelid skin may find it hard to blink and close their eyes if they get Botox. Additionally, it can make your eyes dry, potentially causing other issues. Another thing to be wary of is its side effects. Most doctors will do their best to minimize the side effects, but you may still deal with them for a few weeks. For instance, bruises usually take 2 weeks to go away if you do not treat them. Some patients may get laser treatment the day after Botox injection to treat the bruises immediately. You may see minor results a few days later after your Botox injection. However, you may only see the final results 2 to 3 weeks after the injections. You will also need to get Botox again once it wears off after 4 to 6 months to maintain your results. Thread lift. This one is mostly for the women. Thread lifts are non-surgical brow lifts. A surgeon inserts a small dissolvable thread into the face, then pulls up the skin, lifting the skin as desired. The dissolvable threads have microscopic barbs that hook onto the skin tissue. The microscopic barbs helps the thread pull the skin and keep it in place. Typically, a thread lift for the eye area is for the fox eyes trend, which you can see in celebrities like Bella Hadid and Kendall Jenner. However, your doctor could use this method to correct asymmetrical eyes, especially if your asymmetry is in your eye's outer corners. However, thread lifts could also be a win-win if you want to correct droopy eyelids. As seen above, you can also use the thread lift to get more upturned, fox-like eyes. The results of the thread lifts are not as dramatic as traditional facelifts. However, thread lifts are a great choice if you do not want to get surgery. Eyelid tape. Eyelid shape is what it sounds like, shape for your eyelids. It is trendy in East Asia because women frequently use it to create double eyelids to make their eyes look bigger. Luckily for you, you could also use eyelid shape to make your eyes more symmetrical. It is a good idea if you have two different eyelid shapes. For instance, you may have a large defined crease above one eye, but the other eyelid is monolid. You can use eyelid shape to create a crease above the monolid eye, matching it with the other eye. Eyelid eye works as a quick fix that you can do at home. It may take some time to figure out what methods work best for the results that you want. While it may take some time out of your day, it might be good if you want a simple solution. You can experiment with different types of shapes. Some tape will stay in place to keep the crease that you want. Some people opt for double eyelid glue, making your skin stick together to create a crease. It may be wise to use tape that is strictly made for eyelids. Trying to use other adhesives could damage your eye skin, especially because the skin around the eyes is more sensitive. But what do you guys think? Let me know your thoughts down in the comment section. That's it for today's video. I hope you guys enjoyed it. A like and subscribe will be highly appreciated, and like usual, catch you guys in the next one.